Perkins, editor-host of Exposure, Spotlight Magazine talk show, where your voice matters. Thank you for tuning in with us. Today we will discuss COVID-19 and the vaccination. I am extremely proud to be amid two medical doctors from the state of Florida. Our first guest, Dr. Tina Carroll-Scott, is a board-certified pediatrician who has been practicing for over 25 years. She is a graduate of Princeton University, Boston University School of Medicine, the University of Chicago Hospitals, and Miami Children's Hospital for internship residency. Dr. Scott has built her career as a pediatrician focused on populations in need. She is now the medical director of the South Miami Children's Clinic. Our next guest, Dr. Martha Bertin, is a national board certified advanced family nurse practitioner with over 19 years of experience and more than 35 years proficiency as a registered nurse. Her areas of expertise include internal medicine, diabetes management, infectious disease, and pain management. After obtaining her doctorate in nursing practice in May 2016, she further pursued and successfully completed a postgraduate certification in adult gerontology acute care from Berry University. Ladies and gentlemen, help me welcome these two special guests, Dr. Tina Carroll-Scott and Dr. Martha Bertin. These two wonderful ladies, I am so proud to be in the midst of you guys. We want to give some great information about the COVID-19 and the vaccination because so many people are concerned. They don't know which way to go. And hopefully, and I feel deeply that you all are going to help everyone to make some type of decision in some kind of way, at least to where they have some great information regarding COVID-19 as well as taking the vaccination. So how are you guys doing today?
Doing well. Thank you so much, Lisa, for having us.
Oh, you're more than welcome. Look, truly, I appreciate you all taking the time out of your busy schedule because I know you all are busy, especially during this time of the year and last year and all of that. But look, we greatly appreciate the things that you are doing. So again, thank you for being a part of Exposure Spotlight Magazine talk show. So look, let's start off here. And I know Dr. Scott, you just want to share just briefly, if you don't mind, your perspective about the COVID-19.
Okay, so I just wanted to talk a little bit about what my journey was coming to acceptance regarding this vaccine. And if I'm going to be perfectly honest, even as a medical doctor, I wasn't totally on board with taking this vaccine at the beginning. And for me, it was never about the science. I always trusted that. But I think for me, there were a lot of things going on, I think with the past administration, politically, where, I wasn't sure if the messaging that was coming out from certain agencies like the CDC and the FDA was being vetted in some way. And so that gave me pause. After November and after the election and with the new administration, I started doing my own research to look at the safety profile and just asking questions with fellow colleagues about whether or not this vaccine would put us at any risk with the technology, with the mRNA technology, which honestly, I had not known a lot about that technology. The fact that it's actually technology that has been in existence for over 2 decades. So it's not entirely new technology. There wasn't a need to develop a vaccine though, because we were never in the middle of a global pandemic. So, so for me, that was really important information for me to feel comfortable taking this vaccine. And then I know a lot of people, and I felt this way as well, felt that the vaccine was rushed. I think even the very name of the project, Operation Warp Speed, invokes a lot of fear, and people automatically assume my goodness, why is this happening so quickly? Were critical steps being skipped? And the truth is that none of that happened. It is true that the project was sped up because we needed to do that, being in the middle of a pandemic with people dying daily, but they did not skip any steps. And the reason we were able to do this so quickly is because there was a ton of money put behind this project, and there was political will. And we haven't really seen that with any other vaccine that's come to market. And so that's why we were able to get this vaccine as quickly as we did. So because they had so much money, instead of having to wait to do steps, one after the other, they were able to do steps simultaneously and get this out, to the general public as quickly as possible. So for all of those reasons, and also I think the fact that the National Medical Association got involved, back at the end of November, December, when both of these vaccines were applying for emergency use authorization, because they too were concerned about the hesitation in Black communities surrounding this vaccine. And knowing that Black and Brown communities were being disproportionately affected by this virus, it was important for them to also vet the process. And the National Medical Association is one of the oldest physician organizations for Black physicians. And what they did is that they put together an independent task force to look at the data coming out to make sure that we as Black people were represented in these study trials and that it was in fact safe for us. So when I looked at all of that, that is when I finally made the decision to say, you know what, yes, I am going to take this, this vaccine. And, I'm going to do this because it's not only important for me and my family and those around me, but, I think it's important for me as a role model in the community where I work, which is primarily African-American, with a smaller percentage of Hispanic patients to walk the walk, recognizing that, they've trusted me for the last 13 years being at this clinic and, giving recommendations as far as other vaccines and, treatment modalities for their kids, that if they see me doing this, that hopefully that would pull them along. And so I am fully vaccinated. I received the Moderna vaccine. I received the first one a few days before Christmas and my second one back in January. And so, I was glad that I was able to do that. But even with me doing that, I think it is going to be a Herculean task to get Black and Brown communities on board with this, because we didn't do the legwork. The type of education I think people are looking for should have been done months before the vaccine was actually rolled out. And now we're playing catch up, and then there's an element of urgency because we're in the middle of a pandemic where people are dying every single day. And to do the type of education that we need to do properly, sadly, we don't have the luxury of time. And so that's part of the reason why I was excited to be on this show, because, I really, I know it's not going to take one conversation for people to feel comfortable, but I think the more informed our population is, knowledge is power. And so, I think if we're informed, that we can make much better decisions about our healthcare and our healthcare needs.
Right. Look, that's some great information that you have given just then. And, a lot of people do feel like it was rushed.
Yeah.
So I want to ask this, as you mentioned already before I got to that question, that you are fully vaccinated.
I am.
You have taken both shots.
Yes.
So have you had any type of side effects, or do you feel any certain way, since you have taken it?
So I'm going to talk about a few things. So I was a little hesitant to take the vaccine at first when I saw the UK had rolled out their vaccine, and there were a few cases with people who had allergic reactions. And I actually have a condition called angioedema, where I actually have pretty severe allergies. I'm not even sure what it's to. It's called idiopathic, unknown. But when I have a reaction, I can have severe swelling of my face, my lips, hives. And so when I saw that, it did give me pause. But I spoke with my allergist, and she felt that the risk of taking this vaccine was, compared to actually getting the virus, that, there really wasn't, any reason not to take it. And so I did take it. With the first one, I had, I would say, pretty much no side effects after the first one. I had a little bit of muscle pain at the injection site, but that was it. The next day, I was perfectly fine. I had expected with the second one, because that's what we've seen even in the study trials, that with the second shot, a lot of people have a more robust or stronger immune response. And that did happen to me. So I got it. I would say about 6 to 8 hours later, I started feeling chills. I got a temperature to 101.4, and that lasted for maybe, I would say, 12 hours. And then I was fine after that. I actually didn't even take anything. I kind of just powered through it with the fever and chills, drank fluids, got rest. And then once the fever broke, I was perfectly fine after that. And then, went to work the next day. And I think what people need to recognize too is that having side effects after the vaccine is not a bad thing. It's exactly what your body is supposed to do, because you want your body to produce antibodies or fighter cells, that if you are exposed to SARS-CoV-2, which is the virus that causes COVID, that you will be able to to fight it off. And so, all of those things, the fever, the muscle aches, all of that is completely normal. And, everyone has a different reaction. So you have some people that have very mild symptoms, and then you have, other people that have the full-blown symptoms. And, whether you have mild or, more robust symptoms, one isn't worse or better than the other. It's just your immune system reacting to the vaccine.
Okay. Well, look, I have to ask you another question, and Dr. Bertin, I am going to get to you.
No problem. It's intriguing to listen to this.
But I want to ask you this, because, you mentioned that the side effects it's a normal thing.
Yeah.
I know myself, when I'm taking, prescription, I'm always looking at the things that can cause, to happen when you take these medicines. Yes. And what have you. So then I find myself where I'm reluctant to take that medication just because of those side effects. But I want to ask you this. Mm-hmm. Is there anyone, or have you known anyone to pass away from taking the vaccination?
Okay, so that's a really great question, because I get newspaper articles and videos almost daily from my patients, talking about people who got the vaccine and then the next day they died, or they had, serious side effects after taking the vaccine. From what we have seen, okay, there has been no causal relationship with the vaccine and any of those things. So I think that the viewing audience needs to understand the difference between correlation versus causation. And from everything that they've seen so far, and they investigate all of these cases. And I should mention this, that once you get the vaccine, you are encouraged to actually sign up with a registry called VSafe, or Vaccine Safe, where they track you. And so after I got vaccinated, I would get check-ins, daily check-ins for, at least the first week or two, asking me how did I feel? Did I have any side effects? And they look at all of that, to see if there's a trend, that's higher than what they saw in the vaccine trials that could be concerning, that maybe, maybe there is, like some adverse side effect that they didn't see in the study trials. So you are tracked for that. But so far, no. I mean, they have not seen any causation when it relates to somebody dying, after the vaccine, or having, any other type of, adverse reaction.
Because, with Hank Aaron, he passed away recently, right?
Yeah.
And, they have that out on social media. That
I know.
And it was like 2 days after, if I'm not mistaken, it was 2 days after he had taken the vaccination that he passed away.
No, so I mean, all of that is being studied, and so far, like I said, they have not found any causation related to the vaccine and deaths. And I think also that we have to look at things critically. We have to look at the number of people who have been vaccinated already, both in the U.S. and globally. And already we've had over 65 million people in the U.S. Who have been vaccinated, and another 190 million globally. And then look at the number of reactions that we're talking about. Yeah, and so when you put things in context, even with the allergic reactions, I think for Moderna, it's like 3 people out of 1 million people that had some type of allergic reaction after getting vaccinated, and with Pfizer, I think it was 5. So I think that when we're looking at this data, we just can't hold on to these few cases and not look at the bigger picture of how many people were actually vaccinated where nothing happened to them, and they are perfectly fine.
Yeah. Well, that makes perfect sense, what you're saying. So Dr.
Yeah.
Bertin, what is your perspective on the vaccination? We're going to talk about coronavirus or the COVID-19 because a lot of people really need to know more about how it's really spreaded. So, but can you give us your perspective on the vaccinations?
I wanted to emphasize that I'm in total agreement with what Dr. Scott stated, but I wanted to also piggyback into what triggered a lot of this. Remember, we have a serious amount of mistrust that goes back to Tuskegee days, and most Blacks and Browns, like she said, they either don't have a PCP to have the trust and confidence with them, primary care physician, so that they have the confidence so that they could talk to the doctors, mostly because either they're poor, they don't have a decent enough job that gives them that kind of coverage, access to health care, and so on, So we have that to start with. And not to mention, we are starting a little late to try to encourage the Black community to trust the CDC or the medical association in what we're trying to give them, the information that we're trying to give them. And it's of utmost importance. We're just a little too late in giving them and billing them and including them in this part of the vaccine makeup, what I want to say. I do agree with her in that statistically speaking, the amount of people who've been vaccinated to the ones who have had a reaction, the statistical difference is so insignificant which is why we have to push the drive to take the vaccine. The benefits do outweigh the risk outweighs the benefits. You understand? So most people need to have and get this vaccine. You asked my personal opinion. I too was misinformed until I spoke to Dr. Scott about the vaccine because I had serious allergic reaction. Same thing like she said with the angioedema, anaphylactic reaction. And she explained to me what's the one contraindication to not receiving the vaccine. I am presently alone. I have a family and they're not here. My daughter is out of town and my husband is out of town. Or else I think I would have signed up already to have the vaccine just for my first shot and for the second one. And you did state, Dr. Scott, that the vaccine, the reaction on the second one, everyone seemed to react the same way. The fevers, the chills, the sweating, and it's they're getting a little about building up their antibodies per se to this vaccine, what we really want. So it seemed to be that we're going in the right direction. We want to build up the immunity. We want more people to be vaccinated per se, so that we all could eventually have about what's the term? Like we end up, hopefully we get to a herd immunity per se, where majority of everyone involved would have been vaccinated. And that's what I wanted to say. I haven't received it yet. I had the allergic reaction. My plan is to, knowing that Dr. Scott will inform me about the one contraindication to the vaccine. Dr. Scott, you could go ahead and tell him what it was.
Yeah, so it's actually two contraindications. So if you got the first vaccine and if you did have a severe allergic reaction or anaphylaxis after the first one, then the recommendation is that you probably should not get the second vaccine. The second contraindication is if you have a known allergy to one of the components of the vaccine, one of the ingredients. And what they're thinking is that, the vaccine has a component, an ingredient called PEG, polyethylene glycol. And they're thinking that, the people that are having allergic reactions, it could be from that one particular ingredient. So if you have a known allergy to that, or if you've had allergies to vaccines in the past, the recommendation is, that you probably should hold off on getting it, and you should do that in conjunction with your, with your primary care provider, and decide what next steps should be.
So what could possibly happen if you just take the first dose and don't take the second one? Is there any type of thing or effect or impact?
Okay. No, and that's actually a great question because, all right, so in the study trials, the trials were conducted with the 2 doses, okay? And so, from an evidence-based medicine standpoint, that is why, we're recommending that you do that as well with the general public. But with that said, there is a lot of information coming out, and including this morning, showing
Yes.
that even after the first dose, that your immunity is actually a lot higher than what we originally thought. So the thinking was with both Pfizer and with Moderna that after the first dose, you probably had about, 54% immunity 2 weeks after the first dose. And now what we're seeing, and, Israel actually has done an incredible job as far as vaccinating their population. I want to say they've already vaccinated, like 35% of their population. So they have a lot of data coming out. And, and what they're seeing is that, even after the first dose, like for Pfizer, for example, that, you may get like over 85% immunity with just that, that one dose. But I think it's too early for us to make a general recommendation,
Yes.
to the public to say that, you can just forego the second dose. I think until, we have substantial data to show that the one dose is, is going to be protective long term, that the recommendation is still to get the second dose. Yeah.
Okay.
Not to mention, let me ask you a question too. And we're currently studying the length of time that will be provided immunity to the vaccine. And since it was only used for under investigation with the 2 vaccines, how long would they be studying and tracking the patients for that immunity?
Oh, we're going to be studying patients for a while. I don't have a set cutoff date, but because, this is a brand new virus that none of us have been exposed to. So yeah, I mean, I think as far as tracking and collecting data, that's going to be ongoing for a while. Teresa, I did want to mention one other thing about the distrust in the African American community. And, I think we do have to show, compassion and empathy because, that history, it's a fact, as far as medical experimentation, as was stated before with the Tuskegee syphilis study and, multiple other, issues with medical abuse and exploitation in the Black community. But I think, the message that I would like to get across to the community is that we obviously need to acknowledge the history, and we cannot dismiss that, and we need to to hold people accountable for that. But we also have to look at the reality of what is happening in our communities and the fact that we are being disproportionately affected by this virus, and we're having Black people being hospitalized at 4 times the rate as everyone else and dying at 3 times the rate. And so, what I don't want to see is that these communities get victimized twice, first by the medical experimentation and then by exclusion by not getting this valuable vaccine. So, I think that, we can't sabotage ourselves in the process either by, getting mired down in the history, because I think we will shoot ourselves in the foot, because we are being affected disproportionately. And I think the longer that we wait, because I hear this all the time, oh, I want to wait and see how everyone else does. Well, there's a danger to that, because how long is long enough? Like, do you need to see 3 months of people around you getting it, 6 months, and in that time frame, there could be devastating consequences. You could get hospitalized yourself or even die. So I think there is an urgency to this, and and I think that's really the point that I want to get across to people, that yes, we totally cannot ignore the history, but we have to pivot now, because this truly is a matter of life and death.
Yeah.
I'm bearing in mind that we are here to teach, to comfort, to show the empathy and understand their point of view, but we're also here to teach, show them the empathy, understand what they're going through, and encourage them. Sitting on the wayside is not going to help us. We want them to be included.
Yeah, I'm not sure if the both of you can answer this, but I'm going to ask this question, and I know because the virus, basically, it has been targeting, and I say targeting, but mainly the Black and brown community. And that is because basically they say because of underlying issues, medical issues, health issues, or what have you. Why do you all think that is the case? And I'm going back looking at just the basic general stomach virus, or, you have the flu, and pretty much, all diverse or culture, get the flu, they get the pneumonia or what have you. But why is it that so many of our African Americans are passing away from this virus? I don't know if you guys can answer that, but it's just something that it's just kind of like, I just, try to understand that, even though, like I said, because I'm hearing, because people have, they have underlying issues. It's happening to our people because we have the underlying issues.
Yeah, but that actually is true, because Black and brown communities are suffering at a higher rate from these comorbidities or these underlying health issues that make you more prone to the severe effects of this virus. So the underlying comorbidities, whether it be obesity or heart disease or high blood pressure or diabetes, all of those things put you at greater risk. I think the other part of it too, that we don't talk a lot about, is that we find that that Black and brown communities, that they tend to be in more urban areas, okay, that that are more densely populated, with people living in multi-generational homes. And all of those things, make it so much easier for this virus to be transmitted. If you think about it, if you have one member of your family that gets infected, and our recommendation is, well, you should isolate that person, and that person should quarantine away from the rest of the family so the entire family doesn't get infected. That's almost next to impossible in most homes, in urban places where you have multiple family members living under one roof, and you don't have the type of space to do that. So that too puts people at increased risk, because there's absolutely no way for them to keep other family members safe. And you could have older individuals who live there, grandparents that are already in the high risk group. So I think that too contributes a lot to the to the fact that we're seeing this disproportionately in these types of communities.
And you cannot deny that most Blacks and browns do have diabetes, they're smokers, they have problem with their lungs, they have COPD, they have a bad heart, and we're not exactly the most fit, and we may be overweight in so many different aspects. But the other thing is the barriers, like you said, the access to care, Dr. Scott. They don't have they cannot afford to stay home if they're sick. They need the money. Then they don't want to lose their job. They don't want to lose their homes. And so they tend to work even though they may or may not be sick. And most importantly is that we have patients who are COVID positive that do not show symptoms. So they don't even know that they may be sick, and they spread it that way.
Well, I think you guys just covered that part, because I really wanted to ask, you all to share with the viewers how the virus is actually spread through the community. So definitely you just gave. Is there any other particular way? Because, we can't have large gatherings, and now a lot of states has mandated that you have to wear your mask when you go into public places or what have you. So is there any information that you all can share, addition to what you have already shared, how this virus is actually spread throughout the communities, as well as it's everywhere?
Yeah, I mean, it is everywhere. And I think, and I stated before that there is a distinction, between what COVID is and the virus that causes COVID. So, people have probably already heard, SARS-CoV-2 is the virus that causes the disease, which is COVID-19. And, the virus is thought to spread mainly through close contact from person to person, including, between people who are physically near each other. So, within 6 feet. And people, who are infected, but don't show symptoms, and, we call these people asymptomatic, can also spread the virus to other people. So I think that's really important for people to know, that you may not even show any symptoms, but the reason it's important for you to still wear the mask and follow all of the safety protocols that we've been telling people for the last year is because you could still unknowingly transmit the virus to somebody who is vulnerable. So when people with the virus, when they cough, when they sneeze, if they sing, talk, breathe, they produce respiratory droplets, which can be spread. The one thing that we have found, over the last year, at the beginning, we really thought that you could spread it from touching surfaces. We were telling people if you get grocery delivery or takeout, wipe down everything. And now, we're seeing that that the surface transmission, that's probably not a common way that the virus spreads. And so we've actually relaxed those recommendations. The one thing we do know is that, the virus that causes COVID appears to spread more efficiently than influenza. And we know that for sure it causes more death, more disease and death. So, when people come to me and they're like, oh, COVID is just like the common cold or the flu. And I tell them, no, it is absolutely not like that. It is much more serious, than that. And, honestly, in my medical career, we've never quite seen a virus like this before, that can literally affect every organ system in our body. And there's a lot that we know, but there's so much more that we don't know. And I think that's really the point that I want to get across to people, because, I have so many people telling me, oh, well, it's not that serious, and I'd rather just get it, and be over with it. And, and I don't have to worry about taking the vaccine. And there's a danger to that type of thinking, because if in fact you do get a mild infection, okay, and you don't end up in the hospital or dead, what we're finding now a year into this is that, people are having some serious complications long-term, what we call the long haulers. And they're still having issues with breathing, shortness of breath. They're having neurological symptoms. Their heart has been affected. I mean, a whole host of issues.
And their memories.
So, and brain fog, all of that. And so, so what I tell people is that nobody can give you 100% guarantee with anything, whether it's the vaccine or what will happen to you, if you actually get this virus. But if I'm going to hedge a bet on which one I would rather, have, I would rather take a well-researched vaccine, and any theoretical risk that, that may happen with that long term, versus what we've seen already with the actual virus, and not knowing, whether or not you'll be one of, I guess if you want to call the lucky ones, just because you lived, but not really knowing what will happen long term, or if you're not as lucky and you end up, hospitalized with severe disease or dead. So, that's really what the choice is.
Okay. Look, I have a couple other questions before we bring in, we have a few callers. They want to ask each of you some questions. But my next question I want to ask you, you all remember when this first came out, this virus, people really didn't know exactly what it was. You heard about that it was 5G and just all kinds of different things, right? So I want to ask this question. Do you think, is this a God-made virus, or is this a man-made virus that has taken place? So can you answer that?
I believe it's a true virus. We have true deaths, true illnesses, true sickness, and true loved ones being taken away from us. And we have the proof and we have the documentation. But I also wanted to, correct me if I'm wrong, Dr. Scott, I think when we first started, the first study that allowed us to have the release of the two viruses, this first study, I think one of them was 22,000 people and the other one was about 20,000. Am I correct that they tested? And we had that many people involved in the study to be able to be so convincing with the solution with it being the vaccine. Am I correct, Dr. Scott, about
So between Pfizer and Moderna, as far as the number of study participants, I think it was like 40,000 for one, and another 30,000 for the second one. So yes, I mean, we had a large group of people that participated in both of those trials. But as far as going back to what started all of this, I think that remains to be seen, but the current thinking is that the virus originally came from an animal, like a bat, and then it got passed to an intermediary animal, most likely a domestic animal, and I don't know which one, before jumping from that animal to human beings. As far as any other information regarding that, I think they're still trying to to figure out how that happened. But that is the current thinking.
Okay, because that was a lot of people concerned, and yeah, I think that's another reason why people are fearful, because they don't really.
Yes, I know.
Yeah, so I just had to ask that question, okay? But now my next question is that once a person has been tested positive for the coronavirus and they recover from it, is it possible that they can be infected again without taking the vaccine? Because as of right now, we don't even know if you can still get the virus by taking the vaccine. But I'm saying once you have tested positive and you recover from it, because some people thinking that, okay, I got it before, so I'm not going to get it again. So can they get infected again by it?
Yes. So the answer is yes, and we are actually seeing cases of reinfection now, and the issue with getting the virus and developing immunity that way is that we don't know how long that immunity lasts or how protective it is. And I think the concern with with having natural immunity is that we also don't know, how protective it's going to be against these new variants that are coming out. And so, that's why I'm telling people that really the best and safest way for us to achieve the herd immunity is through the vaccine, okay? Because the vaccine herd immunity, it specifically targets the spike protein, okay, which is on the SARS-CoV-2, virus, which causes all of, the ramifications of COVID-19. And so it's a much more targeted response, as opposed to, the natural immunity and not knowing, how good that immunity will actually be. So yes, you can potentially get reinfected. And so the recommendations are that even if you had a COVID infection and you got over it, that you should still be vaccinated once you're eligible to do so.
Okay.
And if it was to be reinfected or you pass it on, it wouldn't be as serious a case, knowing you were vaccinated. The illness will not be as serious.
Yeah, and let me piggyback on that too, because I think a lot of people assume that with the vaccine that there's no way that you can transmit this virus, that you can't get infected. And what we're seeing right now, and the data is still ongoing, so all of this could change in another few days or even weeks. But from what we can tell, the vaccine does not have, as far as we know, today, what we call sterilizing immunity. So the vaccine will prevent you, from having severe disease where you end up in the hospital or dead. But whether or not you can still transmit the virus if even if you're not showing any symptoms. We don't quite know that yet. Whether or not you're still carrying the virus in your nose and in your throat, and whether or not you can transmit that to others who are not vaccinated and who are vulnerable. So we're still fleshing out all of that data, which is why the recommendation is that even after you get vaccinated, that you must still follow all of the safety precautions that we put in place. You must still mask, you must still socially distance, wash your hands, all of that, until we get more data to show that, maybe we were wrong, maybe once you're vaccinated, you can't transmit this to anyone. And then at that point, we can start making other recommendations that, maybe once you're vaccinated, you don't have to wear the mask, but we're not quite there yet.
Okay.
And hopefully we'll be among each other that most would be vaccinated also. Among each other, everyone would have been vaccinated, so that will cut down on the seriousness.
Yeah, and I wanted to talk about the herd immunity, because I'm not sure if everyone fully understands what that is. So basically, herd immunity, and you can achieve that naturally and then with the vaccine. But the problem with trying to achieve that naturally, which is what a lot of people were talking about at the beginning, why do we need to mask? Let everybody just go out and get the virus, and whoever can't fight it off, let them die, and then it's basically survival of the fittest. So the problem with that mentality and line of thinking is that what we've seen with this virus, yes, it is true that certain groups are at more risk than others, and we know that, which is why when the vaccine rollout happened, they automatically vaccinated the elderly who were in assisted living facilities, and people over the age of 65, because we know statistically that those people have had more severe disease and death. But that is not, true across the board. And we are seeing younger, healthier people, even children, that are being hospitalized now and are having pretty, severe disease and who have died as well. So, achieving herd or trying to achieve herd immunity naturally can have devastating consequences, because you're going to lose a lot of people in the process. So the safer way to do this is with the vaccine, and that's why we're pushing this so hard. And the other fear I have too is that with the hesitancy that we're seeing in Black communities, and we're seeing a huge acceptance with non-Black people. And my fear is that we're going to have these pockets in certain communities where they have achieved herd immunity because they've all been vaccinated. And so they're going to have that wall of protection. And then, the communities that have had lower acceptance are going to be devastated because, the virus has to have a place to go. It needs a host, okay, that is not protected, that doesn't have immunity in order to replicate and thrive. And so that's my fear, that, you're going to have all of these other communities that have been vaccinated and have that protection. And then, we're going to be left behind, when it comes to Black and brown communities, regarding this virus and all of its devastating consequences. So, I think that's something that people should recognize as well. And it's already happening. I mean, to a certain extent, because if you look at the rollout so far, and if you break it down by zip code and who's been vaccinated and who hasn't, right now it tends to be, whiter, more affluent people that have already taken this vaccine. And so, for me, that's very telling. So, for patients who tell me that, that they're still hesitant and afraid, and, and I tell them, I said, but, look at what's happening, what's happening already. I mean, you have, wealthy people that are, trying to bribe people to skip the line. That should tell you everything that you need to know. I mean, if these people are so desperate, okay, to get this vaccine, we should not be opting out on any level. We should be screaming from our rooftops, demanding that our communities be prioritized in these rollouts.
And it gives them a higher percentage rate. Do we not need about 70 to 80% rate to get the...
We're thinking for herd immunity, anywhere from, like, I think Dr. Fauci mentioned, 70 to 85%. And the way that herd immunity works is that, you have a good portion of your population, that is vaccinated and protected, so that this virus has nowhere to go. I mean, it tries to infect this person. No, like, I have my antibodies. No, move on to the next one. And, and it's this wall of protection. And eventually, if you have this wall of protection where you have, 75 to 85% of your population that is immunized, the virus has nowhere to go, and it's going to burn out. And that's when this pandemic ends. This is when we get back to normal. But until that happens,
I wish you had an answer when that could be.
Yeah, no, it all depends on acceptance. The longer people sit on the fence and say, I want to wait to see how it goes with everyone else, the longer we deal with this. And, I'm also going to caution people with this too, because the longer this goes on and we don't achieve herd immunity, this virus is going to continue changing. And, we have 4 or 5, variants now. It could be way more than that down the line. And the danger is that, the current vaccines that we have, which seem to be very good, even with the variants that we have now, even with the most concerning one, which is the South African variant, that, they still look like they are protected. But if we continue with this too much longer, where, we have reluctance with certain communities not wanting to get this, and we don't get the herd immunity, what we have now may not even work, and so there's a danger to that as well, with the vaccines not being as effective, or even the therapeutics that we're using, the monoclonal antibodies in the hospital. I mean, with all of those things. So it really and truly, there is urgency, and it is a race against time, because the sooner that we achieve that and we get people vaccinated and we can burn this virus out, we go back to life as normal. So you talked about concerts, concerts, Mardi Gras, like all of those things that we miss. Yes. We will get to that, much sooner if we get the buy-in that we need from these communities.
At this time, we have a caller. So caller, go ahead with your question, please.
Hi, my name is Sharon. I'm a high school student and I'm from South Florida. And I was wondering, are you doctors scared of the side effects or are you worried or scared of the side effects of the vaccine?
So I'll answer that. I actually am fully vaccinated with Moderna, and I had the normal reactions that that we see after any vaccine, and we always counsel patients about possible effects that they could have, which is your normal immune system fighting against or producing antibodies, to protect you against exposure to the virus. And so it's normal after any vaccine to maybe have a fever. You could have pain at the injection site, swelling, redness, fatigue. And I experienced the fever and chills, but the reactions can vary with every person depending on your immune response. So some people have had absolutely nothing or very mild reactions, and other people have had much more robust responses. But all of it is is completely normal because it's your immune system doing what it's supposed to do to protect you against the virus in the event that you're exposed to it.
Thank you.
All right, thank you, caller, for calling in. All right, and we have another caller. Caller, are you there?
Yeah, good afternoon. This is Mindy. Can you hear me well?
Yes, we can. Yes.
Okay, thank you. My name is Mindy, and I am a resident of Arlington, Virginia. And so my question, and thanks for your time this afternoon and for addressing this topic. My first question is, with the ongoing disaster that's happening around, Texas, Oklahoma, the Southeast, Southwest, there are people who were scheduled for this vaccinations. And I think you probably talked about it a little bit, that when you get the first shot, your immune system is pretty much covered, 86%. But there are people who are going to be missing the scheduled dates. What are the consequences of that?
Well,
So if you were scheduled to take Pfizer today and then 3 weeks later, of course, the disaster was unexpected. What are the consequences to those people who haven't followed due to what's going on?
No, that's a great question, and I am also concerned about exactly the issues that you raised. The one thing that I can tell you is that yes, the recommendation is to get the second shot on time. So for Pfizer, it's 21 days after the first shot, and for Moderna, it's 28 days. But with that said, there is a little bit of flexibility. And now what they're saying is that, you have up until 42 days after the first shot to get the second one. And you really shouldn't have any issues with that as far as decreased immunity or anything like that. So there's still there is a little bit of flexibility with an extended window of time for you to get the second shot. But I 100% agree with you, and I am hoping that that happens. And that that people don't get too delayed, or just because of life, life in general, and dealing with this disaster, that may it may or may not be a priority for them when they're dealing with housing issues and other things that happened with this disaster in Texas. So I too am very concerned about that, but I just wanted to let you know that there is an extended window of time where you can get it, even if you don't get it right at the 21 or 28 days that that we recommended initially, that you have up until 42 days to get that done.
Okay, well, thanks for addressing that. I have a couple questions and then I would stop. My second question, and I know I understand with the disaster, I think it might still be a priority because this is something new. So I have family in Texas, so it's still a priority for the people who are dealing with this, irrespective of the disaster that they're going through right now.
Good.
And it's probably like something that the public health community is going to look into because of, unplanned, circumstances because of what is happening now. Another question I have, and thank you for that. Another question I have is, well, kids under, if you're not, kids cannot get the vaccination. So adults can get the vaccination, but kids cannot. But kids can still get the virus. And sometimes kids are, people may be, people may have the virus. I can't remember the term, it just skipped my mind. You do have it, but it's
but they're asymptomatic. They're not showing symptoms that they, so they wouldn't know that they have it, but they can transmit it.
No, well, my question is, you may be asymptomatic, right? Kids can have it with the rollout that adults can get the vaccination, right?
Yes.
After we have all adults getting the vaccination, there is a push for kids to go back to school.
Yes.
There is a possibility that people might be asymptomatic. Listening to you, there are a lot of people who are under the impression, which it sounds is not correct, that when you get vaccinated, that you are not going to infect others. You won't be able. I really do have some people saying that. I've encountered people like that. They're like, I'm happy I'm vaccinated, but that means I cannot affect somebody else, which it seems is kind of untrue right now. So if we're rolling out a vaccination for a whole population to get vaccinated, which is adults, right? What happens? Because kids can still get this virus. How are we gonna resolve that? Because if kids are not getting vaccinated, but adults are getting vaccinated, how are we gonna beat the virus? Because it might happen again.
Yeah, no, that is such a great question. And I guess, well, two parts. I guess the first thing that I would say is that, you are correct about the kids not getting vaccinated right now. The Pfizer vaccine is approved for 16 and over, and Moderna is approved for 18 and over. Younger children were not included in the initial trials, but now we do have studies that have opened up. With Pfizer studying 12 to 15-year-olds, and with Moderna, 12 to 17-year-olds. And there are a few studies even going younger. I believe AstraZeneca has gone lower, enrolling kids ages 6 to 12. So my guess is that we could see a vaccine, I would say, for the 12 and over age group by this coming school year. I think for the younger kids, though, younger than 12, probably not until 2022. So what I'm telling people is that, this is why it is so critically important for every adult that is eligible to take this vaccine to not opt out. Because if we get enough adults that are vaccinated and we can get to that level of herd immunity that I discussed earlier on, maybe it, there won't be this urgency, to get the kids vaccinated right away. We may be able to achieve, the level of herd immunity that we need without the kids right now. I mean, at least temporarily. So that's my hope, but you are absolutely right. And, the American Academy of Pediatrics, I mean, you have pediatricians, yelling from the rooftops to make sure that we get the data that we need with the children, and, from the older, adolescents to the younger children, so that we can get back to some type of normal. Everyone has suffered on some level with this pandemic, but the kids especially have really, really suffered. And I see this as a pediatrician. I cannot tell you in the last year the number of kids who have come in with severe anxiety and depression. And, not to mention the kids that have not done well with distance learning. I know that there are some kids that, that did well in that environment, But that has not been the case for the majority of kids, and especially in the community where I work, where they didn't have access to a lot of things that maybe kids in wealthier neighborhoods had. And so they did suffer greatly. And really for some of them, it was a completely wasted year. So for me, I definitely want to see kids back in school as quickly as possible, so that they can get back to some type of normalcy. So I 100% agree with you.
Okay, in the last part. So I guess then it is not quite true that if you have taken the vaccination that you are not safe from not infecting someone else, because
we don't
there are a
know.
lot of people who are under the
So we don't know. The jury is still out. Okay, so remember, this is a brand new virus that we've never seen before. So we're still collecting all of that data. So right now, because we cannot say definitively whether or not you can you can transmit it after you've been vaccinated, the recommendation is still to follow all of the safety precautions that we've been telling people for the last year, that you still want a mask, you still want to socially distance, all of that. But as more data comes out, if we see that, that the transmission is low or non-existent, we may update those recommendations. But as of now, we are still recommending that you follow all of the same safety precautions, but that could change.
Okay, and this is my final question. Understanding that the West has done so much, because when in the beginning of your conversation, you mentioned that so much money has been put into getting this done, hence, we haven't skipped steps. But
yes.
When I listen, we can rush to get everybody vaccinated in the West. I think India is really trying to do something, but there are a lot of developing countries that are still suffering, right? And another thing is, looking at brown and black communities, they are usually the ones left behind. But here in the West, we are really pushing, trying to, educate our folks so people can get vaccinated. If part of the whole world is left behind, that's the developing world. We have the Western Hemisphere, which is, Haiti, in a lot of the countries, South America, right? Not to talk about Africa. If we are pushing this vaccine and they are left behind, then the virus is really not going anywhere. What steps are being taken, not only to even, because they're not seeing any vaccines. There are a lot of folks who are not seeing vaccines yet. What steps have been taken to provide vaccines? I'm assuming that you guys talk a lot in the medical community. What steps have been done to, provide vaccines to that developing world, one, and two, while they're rushing to find vaccines, I bet the WHO is doing that. Yeah. What steps have been taken to educate that same community, because a lot are like us, to get ready to take, because they're going to be hesitant as well. And thank you so much for taking my questions.
No, can I tell you, your questions are excellent, and I especially love your last one, because you are absolutely right with that. That even if we achieve herd immunity here in the U.S., we are a global society. People travel all over the place. We don't just stay in the United States. And so you are absolutely right. It behooves us to make sure that all of these other countries are achieving herd immunity as well, because us achieving it and not having herd immunity in all of these other places that we travel to and vacation, in, is not going to do anything to stop this pandemic. I guess the honest answer from me, as far as what all of these other countries that you talked about, are doing as far as getting the vaccine and educating their population, I really don't know the answer to that. I think we're having a hard enough time, in our own country, getting this right with the rollout, making sure that you know, that communities of color have access and that we're being equitable with this distribution. But I mean, yeah, I mean, there are no easy answers, but it is going to be an issue if we, you know, if we do achieve this in the US and then we have all of these other countries that have not done that.
I heard on the radio yesterday that we were putting together a task force that was going to be sending some vaccines to the third world countries that are at a disadvantage.
Yeah.
On account that we had ordered more than we needed, different people per se ordered more than they needed, and they will be sending out that extra doses in addition to a task force to be able to send these extra vaccines to these countries. I heard that just yesterday on the radio, and yeah, I can't recall who will be doing it, but I knew that they were planning on sending some to the disadvantaged areas.
Thank you so much.
Look, caller, thank you for calling in. We greatly appreciate that. And as Dr. Scott mentioned, you asked some really good questions, as well as the other caller. So again, we greatly appreciate you all tuning in to Exposure Spotlight Magazine, because your voice does matter. So we thank you so much, okay? Have a blessed day. All right, so listen, again, Dr. Scott and Dr. Bertin, we truly appreciate you all taking the time out to give some vital information that is really needed in all communities in surrounding areas of the United States, the whole entire nation. People need this information because people are looking for answers, and sometimes they're just not able to get it from their primary physician or what have you. So look, I am so honored, and I count it as a blessing as well as a privilege to be on this platform with the both of you. So we're going to end this conversation, but before doing so, is there anything else that you all would like to share, you know, just to sum up everything as far as for our, you know, our listening audience, because I'm still, you know, because really this conversation here is like, it's never ending. There is not an end to this.
Can I talk a little bit about the kids? And
sure.
Okay, so, you know, as far as what we can do to help our kids, because I already talked about how they have really suffered greatly over the last year with this pandemic. And I think the first thing that parents need to do is they need to put on their own oxygen mask before they can help anyone else. And that means taking care of their own mental health needs and seeking help for that if needed. You know, the kids have suffered greatly this past year with the social isolation and with the uncertainty. I talked about the skyrocketing rates of depression and anxiety. And although things have improved slightly in some areas where schools have reopened, either completely or in a hybrid fashion, you know, we're still so far away from a true normal. So I think the most important thing that we can do with our children is to acknowledge and validate their feelings, maintaining some sort of routine, you know, even if they're doing distance learning. I think that's really important with our kids. They need structure. Encouraging daily exercise, even if it's in your home, you know, 30 minutes of jumping jacks or hula hooping, you know, for younger kids, and 45 minutes to an hour with the older children. We need to try to limit social media and screen time as much as possible. That too has increased exponentially during the pandemic. Making family meals a priority, and it doesn't have to be every single day, but just, you know, I mean, one meal a couple days a week, I think is really important, especially during this pandemic, because we have a ton of research that shows that children who have family meals, that they have lower rates of obesity, drug use, and even mental health issues. Keeping connected with, with extended family, I think is also important. Our seniors are suffering as well with grandparents. And I know it's hard for a lot of people to see them in person, just because of the safety issues, but, maintaining contact with phone calls or even FaceTime. And I think keeping our conversations as positive as possible. Yes, this is scary. Yes, there is a lot of uncertainty, but there is a light at the end of this tunnel that that seems to be endless right now. And the vaccine, we should be hopeful about this, okay? It is our best hope to get back to some type of normalcy, along with all of the safety precautions that, that we've been doing for the last year. And I think we need to lead by example as parents, that if we have kids that are anxious about this and, and depressed about our current situation, I think if we frame the situation in a positive light, the kids are going to follow. And I think also that the best way that we can comfort family members or friends or other people who express fear about COVID-19 is to educate them about the virus and how to protect themselves. When you're educated, that gives you power. So we don't have to feel helpless or hopeless when it comes to this virus. And, I recommend, please, everyone take this vaccine if you're eligible and if it's offered to you. And if you're further down the list and you can't get it right away, continue to wear your mask, socially distance, wash your hands until it's your turn. Because we know that these things work. All of the safety precautions that we've been yelling from the mountaintop for the last year, that it does lessen the spread, and it's gonna stop the bleeding in the interim until we can achieve herd immunity. So I just wanted to to put that out there, that we need to be hopeful, because there is going to be an end to this, but it's going to take everyone doing their part. You can't just look out for yourself. We're part of a society, and even if you think that you're okay and you're healthy and this virus isn't going to do anything to you, we need to look at the other people that may not be as lucky, people in your own household, your family members, or even people that you don't know, that that you pass on the street. So I think we have a responsibility as a member of a society to not only care about ourselves, but to care about others as well. And I think that's really what I want my my message to be at the end of this.
Yes.
I wanted to piggyback on that, Dr. Scott, that the parents are encouraged not to criticize the school or the system in front of the kids, so they have a better positive attitude. Take into considerations that we have kids with learning disabilities, and so that the parents need to listen a little bit more and acknowledge the kids a little bit more and help with different tasks rather than delegating it just to the children. My second point of view was about the question about something regarding the domestic violence and how more people are home and they're encountering different stresses and stuff like that. And I just wanted to emphasize that we are here for them. We want them to, the ones who feel like they're at their wits' end and that they feel alone, they feel like there is no way out and stuff, that you remember that there are resources out there that they need to call, and that we need to, like Victim Connect, resource center and stuff like that, because there's so much going along with what's going on. Yes, most people think that the COVID has triggered the uptake, but we also have to know what the exact cause is. We're so just giving it a blanket diagnosis per se. And in regards to the elderly in the hospital who are hospitalized, who feel alone and not don't have the exposure and the contact, I recommend a few things. That one, that they, if it's a lot of family members, you delegate one person to talk to the medical profession in the hospital. You delegate times that the sisters are assigned to call mama to work on anything, and then you designate the friends to do this. That way the person in the hospital gets some sort of constant contact. We have different means in contact in regards to being able to contact, whether it's an iPad, WhatsApp, or something like that. But there are many people in the hospital willing and readily available to be able to be the liaison between that. But there is a lot of isolation in there. And so if we delegate different times, different people to assign to call that person or to do different duties, I think it helps a lot with the isolation part once they're hospitalized.
Yeah, no, I definitely agree with that. And I just wanted to add this with the abuse, with the domestic violence and the uptick with child abuse as well. And I think, you know, we really need to get the message out for people not to remain silent. So if you are witnessing this with your family or your friends, you need to provide the support and resources, you know, to those people. And I just want to give, you know, two numbers. I know that we're in Florida, but I'm actually going to give the national hotline for domestic abuse, which is 1-800-799-SAFE, SAFE. And the national hotline for child abuse is 1-800, the number 4, and then the letter A, child, CHILD, as in David.
Wow. This is so awesome. We must do this again. We have to. So definitely myself or my coordinating producer will be in touch with you all, because this is so great, so awesome. And truly, I don't know really where to begin, because I really appreciate the both of you to take the time out of your busy schedule to give us information about COVID-19 as well as taking the vaccination. Again, thank you, because I want to leave this with you, Dr. Tina Carroll-Scott and Dr. Martha Bertin. Your voice matters. Most definitely it does.
Thank you.
Yes, thank you so much, and may God bless the both of you.
And you as well.
All right.
Thank you. Thank you.
You're welcome. Bye-bye.
Thank you. Have a great afternoon.
Okay, same to you.
Bye-bye.
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 I just came up with another bright idea. I just came up with another bright